Hello everyone, here's Dr. R. Today we're going to talk about this classical article correlating gum disease to diabetes. We all know that diabetes is related to reduction on quality of life and length of life. How does that correlate to gum disease? Once you have diabetes, you have an increase on inflammation. You have an alteration of the immune response. Your body is not going to be able to respond as well to any aggression. There's articles that report that patients that even have the glucose level regulated, they still have a tendency on increase of cholesterol. So those changes, especially being more susceptible to infection, especially not being able to defend itself as well to infection, will cause you to be more susceptible to gum disease. Once the gum disease has started, this is going to make you more susceptible to diabetes. So they work both ways. The diabetes makes you more susceptible to gum disease, and the changes on gum disease makes you more susceptible to diabetes. So that means if you have diabetes, this can exacerbate the diabetes problems. If you don't have diabetes, this might make you more likely to become a diabetic patient. So how does that all work? Again, the changes that we're talking about diabetes, it has to correlate it to an increase on bad cholesterol and triglycerides. That's how we increase the cholesterol levels. On gum disease, some of the cytokines, some of the byproducts that comes from gum disease, two very important ones is interleukin-1 beta and tissue necrosis factors alpha. Those two cytokines, they will also make you more susceptible to an increase on cholesterol level, being on bad cholesterol and triglycerides. So these both work together to make you more susceptible on the diabetes and make you more susceptible on the gum disease. This also correlates to other diseases that could be related to high cholesterol, one of them being heart disease and others that we have mentioned before. So just to make it clear, chronic gum disease will cause diabetes-induced hyperlipidemia, will cause an alteration on immune response. Your body's not going to be able to respond as well. And will cause a reduction on growth factors. That means your body's not going to be able to repair itself as well. Those changes are very similar to what happen in diabetes. So therefore, that's how gum disease can induce diabetes. This again is one of the classical articles on the subject. It's very interesting and very clear how they correlated one to another. I hope this will help my patients to understand a little bit more the correlation between gum disease and diabetes. I hope this will help them to keep their mouth healthy and keep their body healthy.